Good afternoon, everyone. Happy Friday. I want to start off with echoing a few of the items that the governor shared about Phase 2 that you just heard. I want to really reiterate thanks and appreciation to Secretary Pryor and the Commerce team. I have firsthand experience in seeing his ultimate commitment to making sure that there is full engagement across the state of Rhode Island with the various sectors that have been involved. And we can certainly say that from a public health perspective, knowing that guidance is underlying every step that is being made. The public health includes making sure the economy's health is good, making sure that our education and child care readiness is good, and making sure that all elements of communities are coming together in a way that keeps the public healthy. So we have done that together, and people can be reassured in that confidence and safety as they are returning. I also want to reiterate what the governor said about us needing to be focused on our communities that are being hardest hit as things open up. We have that as the utmost priority as we're going forward, continuing to make sure that the testing, contact tracing, quarantine and isolation supports that need to be in place, and we've been working hard to have in place for the communities hardest hit, continue to be bolstered. We are going to continue to monitor the data very closely at a very granular level. We're going to continue to work with local leadership in the cities, particularly those that are most disproportionately impacted. And we're going to continue to work with the existing infrastructures in these communities. They know what they need. We want to support them in going slow and taking the time they need to make sure that we begin to address together the higher percent positivity. We have the health equity zones infrastructure as one. We have the Equity Council. We have a large group of stakeholders that will be critical as we make sure we continue to listen to the residents in these areas. We need to hear their experiences and continue to be responsive to that. I often say that your health should not depend on your zip code. The challenge before us right now is to reverse that trend, use this COVID-19 pandemic to address that and make it so that every zip code has what they need in this response and in going forward with quality education, housing, and commerce. Also, to shift gears to talk about data, before I update, I want to note that while we will be posting data updates online on Saturday and Sunday, we will not post an update online on Memorial Day. The leadership team of the statewide COVID-19 response and at the Rhode Island Department of Health, including the state health laboratories, will be monitoring the numbers that are needed on Monday. However, we wanted to give some of the frontline members of our data team and our laboratory team and our case investigation team a day to be with their families, particularly to be able to reflect on this Memorial Day. After doing daily data updates continually since early March. Many of these folks have been working 7 days a week. A lot of them have been working 14 and 15-hour days, and so we've all agreed together that this is certainly a day off that is well deserved. In terms of our data for today, we have 170 new COVID-19 cases to report. There are 242 patients who are currently hospitalized. Of those people, 56 are currently in the intensive care unit, and 40 of those 56 are currently on a ventilator in the ICU. Very sadly, we have 23 additional COVID-19 associated fatalities to report. These people range in age from their 60s to being older than 100 years old. 3 people were in their 60s, 4 in their 70s, 9 people were in their 80s, 6 people were in their 90s, and 1 person was older than 100 years old. Our deepest sympathies are with the families and loved ones of these Rhode Islanders who have passed away. Lastly, before opening things up for questions, I want to again reiterate the importance of the basic steps needed to prevent the spread of viruses. Phase 2 that we talked about will not happen until June 1st. From now until then, and continuing afterwards, we all still need to be thoughtful, understand why we are doing this, and make sure we follow the rules about keeping our groups consistent and small. That's the most effective way to continue to stop spread of the virus to additional people. All of these steps help build the confidence for all of us to be able to return to the economy. We need to wear our masks when we're out in public. We need to continue to wash our hands thoroughly and frequently and make sure our kids do the same. We absolutely need to stay home if we're sick and be aware of the high-touch objects and high-touch surfaces around us and do regular cleaning on what we can. For so many of us, this has been a tumultuous, challenging time, but we have been able to follow the rules and get through this together. That is going to continue. Even when we go to a group size of 15, still being able to stay 6 feet apart and wear masks everywhere we can will be key to helping us move forward. During periods like this, it's sometimes helpful to focus on what we can control. The steps I mentioned are what each one of us can do to help keep ourselves healthy, to help keep our loved ones healthy, and to help keep our community healthy as Rhode Islanders. We want to stay in front of this together.